getting back to your vaccines, have they been tested on humans?
They have. Cocaine and nicotine are in clinical trials.
And when might these things hit the market?
Well, when the FDA feels they're good enough to be approved. Some of them are still they're still lacking in terms of getting the immune response strong enough. There's a lot of variability, as you might, obviously diversity in our population, and so the vaccines can work well in some people and don't work so well in others. So those are some things that we need to look at a little more closely. And the other big thing is you're saying how quickly we can move these things forward. I don't know any drug company that's working on any of these vaccines except for one company that's working on nicotine. They will not work on any of these, on heroin. I have tried to go to every major company, biotech companies, Wall Street people saying, hey, would you be interested in funding a heroin vaccine moving forward that we could develop? And it's really, they're saying, well, this is really interesting. You know, I knew someone that overdosed on this. It's great work you're doing, fantastic, but we just don't see a market for it.
Really?
Yeah. It's how much they think they're going to get back.
But there clearly is a market for it, and
drug
companies want profits. I mean, why wouldn't they want to market something that they could readily sell?
You know what? I don't know a lot of HMOs that cover, crack addicts or heroin addicts. So nicotine, smoking, one thing, but they're not, in terms of what they're going to get back, if they're going to try to go forward and make this, Nora can comment more. But to develop a vaccine, the vaccine itself is extremely inexpensive. That's why I thought for third world countries for heroin. Once you have the vaccine made, it's inexpensive. But to move these through clinical trials costs probably $40–50 million at the end of the day. And so for them to put that investment in that, and what they're going to get back in return, is what drives these things, I think. And so, yeah, the value's there.
And you asked me at the beginning about policy issue, and this is one of the most sensitive ones because the science in the whole field of substance abuse is advanced to the point that we could have much better intervention, not just based on immunotherapies, vaccines, and monoclonal antibodies, but actually on medications. But we have this huge gap because the pharmaceutical industry does not feel that there is a profit to be made on the development of these type of medications. Now, this was reviewed many years ago, more than 15 years ago, by the Institute of Medicine that came back and said there should be an incentivization of the pharmaceuticals to go after that, just like we've done in vaccines in this country. If you don't incentivize, the companies are not going to develop vaccines for many of the diseases of childhood. Mm-hmm. My perspective is you're not going to be making money with tanks, but if there is a war, you need to develop tanks, and you then create an incentive because this is...
That was mood lighting, everybody. Yes, no.
So the bottom line is that this is an issue where if we were to create incentives that actually would cost no money to the government, you just, for example, increase the patent that they could get, and the IOM had a whole list of incentives that could be made to accelerate the process. What Kim is saying is actually very, very relevant with respect to the heroin vaccine, because the injection of heroin is the #1 driver of the HIV epidemic in many countries in the world. Mm. And yet, this could be completely averted if there was a treatment intervention such as a vaccine for heroin. And so what is very exasperating is that you have the know-how, you have the knowledge, you know the road, but there is not the resources to move forward in that road. And yet you know that the cost of not moving forward in that road are just gigantic. So that's a little bit of the issues that we play with policy on a field that is stigmatized. So it's stigmatized in the healthcare system, and it's not considered one that is worthwhile of investments by private industry.
Why is it stigmatized in the healthcare system? I understand, definitely when you talk to addicts or addicts' families, co-workers, you understand the stigma, but why in the healthcare? I mean, I'm not saying I agree with it. I think it's a terrible thing.
People who are drug addicts are difficult patients. They're difficult for the system, they're difficult for doctors and nurses, just as they're difficult for their family members. It's part of the disease.
And also the other thing too, they are not easy patients because they are in themselves in a lot of turmoil, but also because there is a belief that they are to blame for the consequences of their disease, and that is where a lot of the
society
stigma
is telling them that.
Yeah, but that's the healthcare system says it's a lifestyle choice. And when I came to NIDA, I was asking, well, how can an insurance deny the treatment for a substance abusers, whether it's nicotine or it's alcohol? And the justification were to one of them, there are no treatments that work, and the other one, this is a lifestyle choice. Well, a lot of the diseases that we develop in chronic, many of them are related to behaviors that we are doing, and yet we never question it. So we treat addiction in a different way.